Welcome to this evening's 596A presentations. We have a lineup of some wide-ranging topics this evening, which will present some interesting ideas. And we have four speakers. They'll have 25 minutes for their talk, and then about 5 minutes for presenting. So let's go ahead and get started. First up is Jennifer Gillespie, and she will be covering a topic titled Explaining Geographic Variation in Shelter Dog Outcomes. Jen, take it away.
Okay, so I'm Jennifer Gillespie. My advisor is Lorraine Dowler, and I'm going to be covering the geographic variation in dog outcomes and hopefully seek to explain it a little bit during my project. So I'm going to start with a current look at the state of animal sheltering and my reasons for choosing this topic. Then I'll move into what I would like to accomplish with the research and how the current literature led me to that goal. And then I'll discuss my proposed methods and the anticipated results. And lastly, I'll cover the technicalities of the project timeline and my proposed presentation venues. So the Best Friends Animal Society has found that 5.4 million dogs and cats enter shelters yearly. Animals can enter a shelter in a variety of ways, the two most common being as a stray or as relinquishment by their owner. There are also some animals that enter the shelter system under what is considered owner-intended euthanasia. In these cases, the animal might be suffering from an illness or injury, and the owner can't afford to put the pet down in a private vet office. It can also happen if an animal might be considered dangerous, and it's up to the shelter to determine what happens to these animals once they get them, if they've been submitted for euthanasia for medical or behavioral reasons. The outcome typically depends on the specific circumstances and who's in charge of that shelter. Animals also might be transferred in from another shelter, and this can happen commonly for shelters who might have more resources or increased demands for pets than others. The outcomes of the animal are quite varied. I've left just the outcomes that would be considered desirable or live outcomes in this case: returning a stray to its owner, adoption, or transferring to an organization with more resources. Unfortunately, many dogs and cats end up being euthanized in shelters each year, often due to a lack of resources, frequently space. What this means is that nationally, an animal entering a shelter has about a 77% chance of leaving that shelter alive. And you'll notice that there are varying estimates for how many animals are put down each year. They range from 1.5 million to 625,000. And I'll discuss the reasons for this later in my presentation. But the important thing to know is that there is some good news about this. The overall number of animals dying in shelters has decreased dramatically over the last few decades. These are charts from research by Rowan and Cartel, who performed a large-scale review to identify trends in animal sheltering since the 1970s. And so you can see that there not only have the euthanasia rates been decreasing, but so have the intake rates. This chart shows California dog trends per 1,000 people, but it's not just in California, it's nationally where the intake has been decreasing. And Rowan and Cartel find that there's various reasons for this happening. The largest contributor being the push for spay and neuter for animal companions. There are also multiple states now that only allow animals to be adopted from shelters if they've been altered. And another reason for the decrease is that more people view adoption as the preferred method for obtaining a pet rather than through a breeder or a pet store. And the third contributor is that shelters have started to implement what they call community-specific programs. And these programs allow them to decrease animals in the community, usually through spay and neuter services, keep more pets with their owners, usually through medical or low-cost immunization care. And they can also keep more animals in the care of the shelter without actually having to house them. And this is usually done through foster homes where dogs and cats are housed by volunteers rather than in the shelter. And that kind of brings me to my inspiration for this project, which is dog fostering. So I'm a dog foster for Austin Pets Alive, which is my local shelter. These are pictures of some of the dogs that I've fostered over the last year, the exception being Oliver at the top middle, who I adopted earlier this year on Easter. And as I was saying earlier, all of the dogs that I've had have come to the shelter for different reasons. In Oliver's case, he was picked up as a stray in a rural county and was brought to a local shelter, and then he was transferred to Austin Pets Alive. So this is pretty common for APA because they have more resources to bring in dogs from rural areas where they might not be able to find a home. With Oliver, it was pretty clear that he had never been in a home before. He was pretty well under-socialized, really afraid of people, and he's still pretty afraid of strangers. So one of the reasons that Austin is able to bring in so many dogs like Oliver is that they have a large foster home network. It's also one of the main reasons that Austin is one of the largest no-kill cities in the country. Austin saves about 98% of the animals who enter their shelter system, but that's certainly not the case for the rest of Texas, which averages a much lower save rate, around 73%. We'll see varying numbers. So the next source of inspiration for this project was that I found an article entitled The Puzzling Geography of Animal Shelter Dog Euthanasia. The doctor, Hal Herzog, wrote this, and he points out that there's a great geographic disparity between shelter outcomes across the US. In North Carolina, for instance, they euthanize about 7 times more dogs per 1,000 people than New Jersey. So when he was looking for an explanation, he ran a linear regression model and found that euthanasia is negatively correlated with statewide household income, meaning that as income increases, euthanasia rates decrease. His model shows that about a 40% of this geographic disparity in outcomes can be explained by only income by itself. So when I looked further into this, I found that a lot of research has identified geographic disparities at a national level. And so there's 2 maps here, one being the live outcome rate by state, another being the euthanasia rate by state. And these are pretty similar ways, kind of opposite ways of looking at the same thing. And you'll notice that the Northeast has high live outcome rates, that would be the dark orange areas, versus the areas in the South, in California and Idaho, which have much lower live outcome rates. But what's interesting is that North Carolina and Virginia are right next to each other. So you'd think they'd be kind of similar, but they actually have very different euthanasia rates. And so the question becomes, what's happening here? And Rowan and Cartel found a pretty similar pattern occurring within states themselves. In California, for instance, there's a large variation in euthanasia between the counties. Fresno has a euthanasia rate of about 13 dogs per 1,000, whereas in San Diego, it's only 1.5. So the numbers show that coastal counties tend to have lower rates than the inland counties, and the authors posit that one reason for this is that coastal counties tend to be wealthier. But as it turns out, it's not just about the money. This is a quote by Andrew Rowan. He says that Fresno County in California has a euthanasia rate of 35 per 1,000, whereas in San Francisco, it's 1 or lower. So if you're looking at expenditures, Fresno is around $15 per capita, and San Francisco is around 30. So it's double. But if you look at the areas around Portland, they have a per capita expenditure of $16 and a euthanasia rate 1/10 that of Fresno. So they're spending roughly the same amount of money, but they're saving more dogs. With all of this in mind, I was able to formulate my problem statement. There are healthy, adoptable animals who are being killed in shelters due to a lack of resources, but the euthanasia rates vary across the country, and in no literature I could find were there any studies that seek to explain why this pattern exists. So my goal for this is to explore this issue by attempting to identify which demographic factors are correlated with animal shelter outcomes, and then visualize how these demographic factors vary spatially. My hope would be that this type of research will help communities and shelters identify what is driving their euthanasia rates, so they can put in place more specific programs that will work for their specific area. In the way I see it, there are 3 overlapping things that I need to address for this project. One being, of course, the shelter statistics, that be answering the questions of where do the animals come from, where do they go. Also looking at the demographics of the community, of which the animal shelters serve, and then also looking at the statistical method that I'm going to use to tie them both together. So I'll start with a look at the shelter statistics. In the 90s, one of the researchers called shelter data a statistical black hole. And one of the reasons for this is that There wasn't then, nor is there still, a national reporting requirement, which means the federal government doesn't collect shelter data. It also means that until very recently, there was no accurate count of the number of shelters in the United States. Within the last couple of years, Best Friends Animal Society has been able to fix this by a large-scale effort to get the number right around just under 5,000 brick and mortar shelters and rescues. But overall, this means that statistics are generally estimates and are going to vary based on the source. Some states have addressed this by setting their own requirements, like Colorado and Michigan, but what is collected varies from state to state. And knowing that it's hard to address a problem when there's little data, the animal shelter welfare groups came together. So they include Best Friends, Humane Society, ASPCA, probably all ones you've heard of. They came together to create the Asilomar Accords, which is a list of rules to make data collection across organizations more consistent. And then they went on to create the Shelter Animals Count database. This database uses the basic data matrix as the underpinnings of their data to allow shelters and rescues to self-report their data. The first year of data collection was 2011, and the most recent reporting year being 2019. In 2019, a little under half of all the organizations provided a full data set, so it's clearly not being utilized by everyone, although the number of organizations reporting has increased over time. This data is probably what I'm going to be using for my research. It's downloadable for a fee, and it provides it in CSV format. But additionally, just last year, Best Friends Animal Society launched what they're calling the Life Saving Dashboard. This is an online interactive viewer that allows the user to see basic statistics for every shelter in the country. The data is gathered from a variety of sources, including the Shelter Animals Count dataset, state and local governments, and direct outreach to organizations. The dashboard includes data for about 74% of organizations. So it's got a much better coverage, but unfortunately, this data is not downloadable, so it's much more difficult to use. They do have a nice interface where you can look at the community level view on the left or your specific shelter on the right. So I pulled up Boston Pets Alive and you can see that their save rate's about 90.2%. And this includes dogs and cats. So if I wanted only the dog data, I'd have to manually gather that. So let's kind of look at the shelter statistics. The next question is what demographics might be correlated with these shelter outcomes? And for the answer to this question, I turn to a pet survey that's put out every 5 years by the American Veterinary Medical Association, and I gather data regarding pet ownership. And I'm going to be focusing specifically on dogs during this presentation, partly for time and partly because there's inherent differences between cat and dog owners, but also because there are a lot of community cat programs. So these would be cats that live in the community, not in the shelter, but are also not owned. And I expect that the demographics that drive dog euthanasia rate are going to be quite different from those that drive cat euthanasia rate. And I think they're probably best suited for studying separately. So what I first noticed about demographics for dogs was that they also vary geographically. This map shows the top 10 and the bottom 10 states for dog ownership. The states with the lowest ownership rates are clustered in the Northeast. If you'll remember, these are also the states that have some of the lowest euthanasia rates, so that kind of correlates together. After looking through all the AVMA data, I was able to come to the conclusion that in general, dog owners are more likely to be white, live in their own home, have higher incomes, live in a rural area, or be part of what they consider a family. This can mean couples who live together, as well as those who have children. And children being in the home, unsurprisingly, means that it's more likely that there's going to be a dog in the house. So this tells me a little bit about the people who own dogs. My next step was to find out what demographics might lead to shelter intake. And from the research, I know that the two most common ways that a dog enters the shelter is as a stray or through owner relinquishment. Strays make up about half of all intakes nationwide. So research here by Dyer and Mallow looked at intake data for an open admission shelter in DeKalb County, Georgia. This would be pretty much the Atlanta area. The team found that there are geographic hotspots where more stray dogs are picked up. And these are indicated on that map in the red and orange circles. And the team of researchers correlated these hotspots with something called the Social Vulnerability Index. This is a metric that's typically used by the CDC to identify communities who might be at more risk for external stressors on human health problems. But the Social Vulnerability Index, or the SVI, takes into account a lot of different demographic data sets, including race, poverty, and housing characteristics, all of which are things that I would also be interested in. And the areas that are being identified as more vulnerable, having the higher SVI, are also the areas that were correlated with more strays in the community. And other studies have found similar things, and they found a link between stray intake and areas of higher poverty and cases of child maltreatment. So if we take a look at demographics that might lead to relinquishment, there have been various studies that found that relinquishment reasons vary geographically, but the reasons usually fall into fairly similar categories. Those reasons can be grouped into those concerning people and those concerning pets. People reasons are those which are not related to the animal. So this may include housing or the inability of the owner to pay for care. So in fact, in this study by Dolan, when they looked at what had changed within the household leading up to relinquishment, the most common items were related to cost and the problems with the landlord. Other personal reasons might be a lack of time or medical issues of the owner or family member. For instance, in one survey of a relinquisher, a child in the family had severe allergies, and so the owner had to make the decision to give the family dog up. In this study shown, pet behavior only accounted for 7% of all reasons for relinquishment, versus the other reasons that are all characterized as people reasons. This finding was backed up by other studies that have been done that show that pet reasons account for about 38% of relinquishments when you're talking about dogs. So it's usually the person and not the dog. I'll also summarize some adoption and demographic information. And what's interesting here is there hasn't really been a lot of research about what demographics can lead to adoption, but I did find one study by Paternek in 2010. He made an effort to understand who was adopting from one shelter in Massachusetts. Paternek used location data of adopters to identify certain market segments that are correlated with adoption. And the market segmentation data he was using is the Esri Tapestry dataset. So if you're familiar with that, you know that the market segmentation data groups, they group people who live in certain areas based on common demographic variables. And this data is often used for retail and advertising, but of course can be used for other things. And this segmentation data aggregates the demographics together, so it isn't exactly clear which specific demographic variables might drive adoption. But Paternek was able to determine that adopters are more likely to have higher incomes and are also more likely to be families with kids. So this isn't surprising based off of demographics of dog owners. And unsurprisingly, he also found that adopters are more likely to live close to a shelter. So I've got my information on shelter data and the demographics of pet ownership. The next step was to figure out how to tie these together using spatial analysis. I'm proposing to use multivariate linear regression to help show how the independent variable, in this case demographics, can influence the dependent variable, in this case shelter outcome. And this is going to provide me with an equation with the coefficients to show how each independent variable how much of that independent variable might have an effect on the outcome. So my required data for this is going to be the independent variables or demographics. I'm going to be focusing on those which I've already discussed and which are tied to pet ownership. These are going to include race, household income, poverty rates, housing variables, family structure and composition, and city size and growth rate. I'm also considering using the SVI from the CDC as a single variable to see how much of the geographic variation in outcomes can be explained by this single item. So the dependent variable in this case is going to be shelter outcomes. There are two accepted ways to calculate this. One is the live release rate, which you'll see more frequently in the literature. The other is the save rate, which is what's used by Best Friends Lifesaving Dashboard. In the shelter animals count data set, I'm going to be getting the raw data, so I'll be able to calculate either of them from that. But if I do end up using any data from the Best Friends dashboard, I'm going to be only using the save rate only. So I plan to use ArcGIS software for my entire analysis. ArcPro provides pretty much all the tools that I'm going to need, including a really helpful tool called exploratory regression. And as the user, you just provide all the variables that you're interested in, specify the dependent variable, and then the program will go through and do all the hard work for you, basically. So it just could provide the best model. And this tool will allow me to quickly get a sense of which demographic variables are the most important, and then I'll be able to tweak it from there. And then once I've identified the demographics that are the most correlated with outcomes, I plan to use geographically weighted regression to dive deeper into the data. GWR takes into account how the influence of independent data can change over space. So for instance, if I found that in California, household income might be a larger contributor to shelter outcomes than the percent of people who own their own home, but that might be completely different in Washington, D.C., where the income of the owner doesn't matter as much as whether or not they rent. So data that behaves this way is called non-stationary data. And based on the patterns that have emerged in the research, I'm assuming that my data is going to be non-stationary. GWR is a local model, so it creates an equation or model for each data point in the set, which means it can provide insight into which demographic factors are important to a specific place. And because GWR is a local model, it performs better on very large data sets. From literature, I've seen that they recommend using up to over 1,000 entries, and this means that I'm going to be running on a community level, but it wouldn't be as useful at the state level. So here's a quick synopsis of my proposed workload. I'm going to start with the data processing, which is going to include downloading, cleaning, aggregating the data. I haven't decided yet exactly how I'm going to aggregate it. I'm hoping to be able to use census units. The shelter animals count data comes with state and zip code, but not county, which makes it a little bit more difficult to work with this census. Fortunately, the Census Bureau has created zip code tabulation areas, which can kind of help bridge the gap between zip codes and blocks. I'm then going to calculate the save rate and the live release rate for each census unit. The next step will be to run the exploratory regression using the typical ordinary least squares method. And then the plan will be to run exploratory regression both at the state level and the community level. And then GWR adjust the community level to see how the influence of certain demographic variables vary spatially. For this project, I'm assuming that my main challenges are going to be data availability, which is going to be the lack of data, especially from the SAC data set, and then also best friends, which is difficult to obtain. I also expect that many of the independent variables are going to be collinear, meaning that they're correlated with each other. I expect this especially for things like income levels and owner-occupied housing rates. I also expect that there's going to be some spatial autocorrelation among variables, which is going to make it difficult to find a properly specified model. I'm going to have to identify these issues through diagnostic statistics. Once I get there, there's really no way to deal with it beforehand. So as for anticipated results, I'm hoping that I'm going to be able to answer these two questions at the end of this, being which demographic factors are most closely correlated with the shelter outcomes, and how does the influence of the demographic factor on outcome vary spatially, and also be able to visualize this for across the country. Well, timeline of my project, I've got my final elective to take in the spring, so I'm probably going to be doing the bulk of my work during the summer and then presenting in the fall and taking Geog 596B. I'm hoping that I'm going to be able to both present at a conference and also publish the results of this. I'm targeting presenting at a conference that is going to be animal welfare specific, like the Association for Animal Welfare Advancement or the Conference of the Federated Humane Societies of Pennsylvania. For some reason, neither of these work out. There's also a spatial data science conference, which happens in the fall. As far as journals, I've listed 3 there, which are the ones that are likely to be interested in research like this. And so with that, these are all of my references for this presentation, although I have read more than that, and I'd be happy to take any questions.
Okay, great job, Jen. Looks like you're really blazing some new territory here with your research. So look forward to seeing the results of that. I ask that as the questions come into the chat window, if you could read the question before you respond, that would be great. As people are typing some questions, I have a question that I hope you can respond to. Um, Certainly, COVID has created some, I guess, unique situations with pet ownership and adoption. I don't know if you're going to address that at all in your research, or another idea that I had was looking at some of the temporal kinds of adoptions, particularly around Christmas time, and then people get the pet, they realize, well, maybe that's not really the thing, and then have to give the pet up. So, two ideas for you to think about.
Yeah, those are things that I'd really like to be able to look at. Temporally, it'd be very difficult because unless you would get the data with the date applied to it from a shelter, you're not going to know what happened when. The data sets that I'm looking at don't really have that temporal component. They just list it by year. And then as far as COVID, um, I know there was a huge spike in adoptions at the beginning of COVID, and now I think that's probably slowing down, at least for my local shelter. And if data for 2020 becomes available before I've finished my project, I'm definitely going to be interested in looking at it. It might be different than the 2019 data.
Okay, thanks for that.
Okay, so I've got a question here from Ryan. He said, given that it might be hard to collect data nationally, are you having to focus on just one state or region, or is there a particular place that you think would be interesting to investigate? So I'm hoping that I'm going to be able to do it nationally from the shelter animals count data set. It's obviously going to be missing some pieces, but it's kind of going to have a national spread. But what I'd like to be able to do, although it might take some effort to get the data, is to pick like a few regions in specific areas, like maybe in Texas, that's because that's where I live, and get like more community level views from that. And I've also got another question from Robert. If you're unable to obtain the data you need, have you considered any alternative measures that will allow you to move forward with the project? I don't think I'm going to have any problems obtaining the data. I think it's just going to be the shelter animal count data set. They have a form that you can fill out in order to download it. So I know I'm going to be able to get that. It's just costs some money. So hopefully I don't have to worry about alternative measures, Robert. And I've also got a comment from Louisa that says that the Missouri Data Center has a tool to convert census geos from one unit to another, which is really cool. I didn't know about that. So thank you, Louisa.
All right. Well, great job on the presentation and good follow up on the comments. Alexander, if you want to go ahead and start sharing your screen, we'll get things set up for your presentation. So next up on the list is Alexandra Crow, who will be giving her talk on spatial analysis and visualization of environmental risk factors for heart disease in rural Appalachia. Alexander, take it away.
Yeah, it's a bit of a mouthful. Can everyone hear me?
Yes, we can.
Okay, great. Hello, everyone. My name is Alexandra Crow, and I'm an MGIS student focusing on geospatial programming and web map development. My advisor is Dr. Louisa Holmes. I've learned so much in my courses at Penn State, and I'm very excited to finally start working on my capstone. The title of my capstone research is the spatial analysis and visualization of environmental risk factors for heart disease in rural Appalachia. The intent of this capstone is to research the relationship between some suggested environmental risk factors for heart disease and rurality. The visualization piece will be an interactive web map to explain and visualize the results of my data analysis. The web map portion will be no small feat, but it's important to fully understand heart disease and its associated risk factors in order to conduct adequate research. In this presentation, I'll give a brief background and overview of heart disease and its associated risk factors. Then I'll explain my variables and spatial focus area, Appalachia. And then I'll discuss my methods, data, and dissemination expectations. And hopefully that will leave some time for questions. I chose this topic primarily because heart disease has been the #1 killer of Americans since the early 1900s. An advancement in technology has just given us a better explanation of why and where this disease is most prevalent. The southeastern United States has been studied time and again, but I want to focus on Appalachia because it's where I'm from, and I've seen heart disease and its effect on real people here. It can also bring, the environmental factors will also bring a spatial component to the answers of where it's most prevalent. The visualization piece is important to me as well because I've really enjoyed the web map programming techniques and trades that I've learned in my courses at Penn State. I plan to create a beautiful interactive web map that can be used to display my results. So what is heart disease? Heart disease is a branch of cardiovascular disease and is the leading cause of death in the United States. The CDC describes heart disease as a collection of several types of heart conditions, the most common of which is coronary artery disease, and can be brought on by poor lifestyle habits and health conditions. Where is heart disease most prevalent? The spatial distribution of heart disease is probably very familiar and not shocking for many of you. Across America, heart disease is primarily focused along the southeastern rural counties, forming what is colloquially known as the stroke belt. And the stroke belt is an 11-state region of the United States where studies show that the risk of stroke is 34% higher for the general population than it is in other areas of the country. This map shows the heart disease hospitalization rate for people over 65 in the years 2015 to 2017 and was published by the CDC. I want to just ask yourself why you think this region is most affected. The rural southern counties are clearly most impacted, and throughout my research, there are distinct rural-urban disparities for heart disease and its associated risk factors. Rural counties have a high prevalence of poor eating habits, obesity, hypertension, drinking, and smoking, and poor overall health. The South and its many rural counties have been studied extensively, but I'd like to turn your attention to Appalachia. The Appalachian region of the United States includes parts of 12 states and all of West Virginia, for a total of 13 states included. There are 420 counties, 107 of which are rural. The population of Appalachia is around 25 million people, and consider that nearly 20% of adults in the region report being cigarette smokers. Almost 1/3 of adults are considered obese. The prevalence of diabetes is 11.9% compared to 9.8% in the country overall. And 21.8% of adults over the age of 20 report being physically inactive. It is also an area of the country known for its poverty and limitations on medical care. Heart disease mortality rate in Appalachia is 17% higher than the national average. And that is because the prevalence of these heart disease risk factors are very high in this region. So there are two categories of controllable risk factors that can lead to the development of heart disease, which are health conditions and behavioral risk factors. Specifically, the health conditions that can lead to heart disease are high blood pressure, type 2 diabetes, obesity, and bad cholesterol levels. These health conditions can affect the heart and other massive organs and can lead to very serious issues. The prevalence and spatial distribution of these health conditions are well researched, which I'll talk a little bit about in the next slide. The other set of controllable risk factors are lifestyle choices, to include not getting enough physical activity, poor eating habits, alcohol, and tobacco use. All of these risk factors are controllable and can be reduced. However, about half of all Americans have either high blood pressure, high cholesterol, or smoke. Throughout my research, there are also many suggested environmental risk factors that have a relationship with heart disease prevalence. Research is primarily focused on the collective cardiovascular disease rates, but this study will focus on heart disease. These environmental risk factors might help explain an additional element to the increase in heart disease in rural areas: neighborhood greenness, air quality, and weather changes. The health conditions that can lead to heart disease are controllable and in many cases reversible. However, the prolonged effects can cause massive damage to your heart and other organs. High blood pressure, if not controlled, is often called the silent killer because it has no symptoms, but it can be lowered with lifestyle changes or medicine. This map shows the hypertension hospitalization rate from 2015 to 2017, reported in the BRFIS survey and published by the CDC. You notice how similar it looks to the heart disease map that I showed earlier. Type 2 diabetes causes sugar to build up in the blood. The risk of death from heart disease for adults with diabetes is higher than for adults who do not have diabetes. And this map indicates the percentage of type 2 diabetes in American counties as of 2016, with the darker areas as a higher percentage. Obesity is linked to higher cholesterol and can lead to high blood pressure and diabetes, as well as heart disease. This map, also published by the CDC, shows the percentage of obese population over the age of 20 in 2016. Notice how each of these maps are darkest around the southeastern states and look very similar to the heart disease map I showed earlier. The final health condition that is a risk factor for heart disease is high bad cholesterol levels. If we take in more cholesterol than the body can use, the extra cholesterol can build up in the walls of the arteries, including those of the heart, leading to blood flow constrictions to major organs. Spatial distribution of cholesterol levels is not well documented, but as my focus is environmental factors, it will not be a major part of the study. Your lifestyle can increase your risk for heart disease. Not getting enough physical activity, eating a diet high in saturated and trans fats and cholesterol can lead to heart disease. This map shows the prevalence of physical inactivity reported by the BRFIS survey. Take a look at those southern states. 4 of the states in Appalachia have over 30% inactive adults. Drinking too much alcohol can raise blood pressure levels, and tobacco use increases the risk for heart disease and heart attack. This lower map shows the prevalence of binge drinking in 2015. Something interesting about this map is the increased prevalence in the northern states. However, the scale of this map is something to consider because the lowest rating is 10.9%, if you can read it there. While there is extensive research on these health conditions and behavioral risk, my focus will be on the environmental risk factors. The first being green space. The amount of green space in a neighborhood, such as recreational parks and forests. I'm sorry, my dogs are barking if you can hear that. So the amount of green space in a neighborhood can be measured by recreational parks and forests, has shown to affect heart disease rates. Several studies have concluded that environmental exposure and neighborhood greenness reduces rates of cardiovascular disease because of more space to exercise and a possible connection to cleaner air. These studies have conducted NDVI image analysis of neighborhood greenness and suggest that cardiovascular disease declines in greener areas and where urban planners include environmental measures into the city's design. Green areas will be a main environmental factor considered in my spatial analysis and has not been extensively researched against heart disease in Appalachia. My second variable is air quality. There is extensive research to suggest that air quality and cardiovascular disease are linked across the globe. There is fine particle pollution in the air we breathe, and studies have suggested that high rates of daily exposure can lower overall life years and affect rates of heart and other cardiovascular diseases. National and state studies suggest that ambient air pollution has a direct relationship with increased blood pressure and heart rate, and effects are elevated among those who are already at risk of heart disease. We tend to think of air pollution as a symptom of urban areas, but air quality is still reduced in rural America as well. This map shows statistical hotspots of PM 2.5 and those fine particle pollution. And Appalachia is heavy on industrial factors and factories and mining. And you can see on this map that there are persistent to sporadic hotspots of air pollution, which could have some part in explaining the heart disease rates. The rural-urban connection of air quality and heart disease is not well documented, so I hope to fill some of those gaps with my spatial analysis. My third main variable is seasonal changes. There's some research to suggest that seasons may also influence heart disease rates. A study conducted in Melbourne, Australia, analyzed heart attack admission rates across a span of 5 years. The results of this study showed a higher rate of admission in spring and after the coldest part of the year. There is strong research supporting seasonal effects on heart disease, admission rates, and mortality. However, little research has been conducted on the spatial distribution of seasonal effects. However, a predictive study from 1997 suggests that in 2020 through 2050, climate change will affect dramatic increases in summer mortality rates in the United States. These predictions have not yet been tested or researched, but as we've seen temperatures increase over the last several years, I'm hoping to answer if these rates have already increased or not in the Appalachian region. This collection of maps that you see shows the predictive temperature rates for 2021. And basically it's going to be hot, hot, hot. The region of Appalachia, being geographically and climatically diverse, is an interesting area to study temporal changes to heart disease rates. My study will consider counties with more defined seasonal weather changes as a higher risk location for heart disease. Extensive research has not been conducted on the collective nature of these 3 environmental risk factors, which will be the focus of my study. Overall, the well-known controllable risk factors have been relatively well documented in Appalachia, but with little research on the suggested environmental risk factors. So considering all these facts, I decided to focus my project on the environmental risk factors in Appalachia. I will study the spatial trends of county greenness, air pollution, and seasonal changes as it relates to this region. I will do this by configuring an environmental risk factor index based on a county's low greenness, high amounts of air pollution, and large difference in seasonal temperature changes. This environmental risk factor index will be a numerical range from 0 to 8, with points given for each of the tested environmental risk factors. So for example, in county greenness, a county with in the lower tertiary of the NDVI image analysis will receive 2 points because our studies show that less greenness means higher heart disease rates. And counties in the middle third will receive 1 point, and counties in the upper third, so more green, will receive 0 points. The air quality index will be based on yearly averages reported by the EPA with a similar scale conducted for the overall environmental risk factor index. Seasonal changes will be calculated as a difference in temperature between the winter and summer months, as research has suggested that summer rates will increase because of the drastic change in temperature. Then, using geographically weighted regression, I will deduct if any links exist in this region between greener counties and areas of lower air pollutants. Current literature does not combine air pollution, climate change, and the greenness factor into spatial trend research or heart disease research. My study will be conducted to narrow that gap in Appalachia. And I hypothesize that rural areas with a lower environmental risk factor index will show decreased rates of heart disease. A significant portion of my data will come from the Behavioral Risk Factor Surveillance System, or BRFIS. You've heard me mention it a couple times now. It is the premier survey that conducts nearly 400,000 adult interviews each year and collects data about U.S. residents regarding their health-related risk behaviors, chronic health conditions, and use of preventative services. Part of the survey is asking individuals, have you ever been diagnosed or been hospitalized with heart disease? Those are the kind of factors or questions that I'm going to be looking at. The environmental data is all remote sensing collection. I'll calculate the greenness factor through NDVI image analysis provided by USGS. EPA has the air quality data and NOAA has the temperature data. After conducting my spatial analysis, I will write this analysis into a research paper with my findings. I have not completed a wireframe yet for my web map, but I plan to make it interactive with layers that you can turn on and off and a slider bar to compare the greenness, air quality, and seasonal changes in counties with the heart disease rates. So the user can kind of toggle between the different maps and the different views and kind of make consider their own reasoning as to why the results came out the way they did. And the overall plan is to present in July at the user conference, whether virtually or not, and take the 596 Bravo course in and over the summer. Okay, so that's my presentation on background and methods for environmental risk factors for heart disease in Appalachia. I'd be happy to take any of your questions.
All right, Alexander, that was a great job. Again, questions start to appear in the chat window, if you could read the question first before answering it, that'd be great.
Okay, I got a question from James. How did you come up with the environmental risk factor index? So that's actually a really good question. I kind of went really trying to figure out how I wanted to weigh these different variables and kind of give a county like a number. So there was actually one of the literature review or researches that I read for my literature review did something similar for social risk index, where they basically took the population's so they indicated a social risk for heart disease. So people living alone, people with a lower income, and several other risk factors that are social, socially, whatever risk factors. And they created this index. So based on the prevalence of that in a county, they gave that county a risk index number. And I just kind of, I don't want to say copy, but use that method for environmental risk factors to replicate that kind of study. Paul Kim asked, do you have any idea on the intrusiveness of the health surveillance organization? Can you explain what you mean by that a little bit? I don't have any idea if that's what your question is. Paul, is that something that I should look into? Okay. Oh, sorry. He says, I guess it's more about how voluntary the participation is. Oh, yeah. So the survey, yes. So it is voluntary and it's all over the phone. But the survey itself is actually one of the most reputable surveys, phone surveys that they do for monitoring health information across the country. It was used in pretty much all of the research that I've read, and it's one of the standard data sets to use for health across the health for the country. So it's intrusive in the sense that it asks like the individual if they've ever been, diagnosed or been hospitalized for like all sorts of diseases, but it doesn't report the individual themselves or any sort of personally identifiable information. I think the most personal that they get in the data sets is the county or metropolitan area that they come, like the closest that they can get. There's not even addresses.
So I have a quick question for you. Thinking a bit beyond just creating the web map, what, if anything, have you thought about in terms of how this could be used to change behavior, right? Because it's largely behavior that's contributing to these kinds of occurrences. So maybe you could expand on that question for a few.
Yeah, absolutely. So since I'm focusing on the environmental risk factors, I think what the results can hopefully change or affect are primarily those green spaces. I think that helps with urban planning. If there's a lot of data out there to support that more parks, more recreational areas, gets people physically active, gets a neighborhood, gets a location out there and active, lowering rates of not just heart disease but other obesity caused illnesses and diseases. Air quality and seasonal changes. I mean, those aren't those aren't lifestyle affected, but the idea of these environmental risk factors indicating where heart disease rates are highest or lower could kind of point to pinpoint where those lifestyle changes are going to be highest as well. So I'm kind of like creating that correlation between those lifestyle risk factors and the suggested environmental risk factors.
Okay, thank you.
Gregory Thomas asked, with Appalachia divided into separate regions, do you plan to conduct your study over the entire area or focus on specific regions? And do you anticipate any issues with obtaining data on these regions? That's a great question. So looking at Appalachia as like my main region of study, but I will be the data will be down to the county level. So it really would just be the counties within Appalachia that I'm looking at, instead of looking at the entire county or country, excuse me, primarily because a lot of that data has been done. But I think looking at it at a smaller level gives us a better picture into different regions of the country. Do you anticipate any issues with obtaining data in these regions? So because the data is done through the BRFIS, EPA, NOAA, all of these national level, national data sets that can be aggregated to the county level, or they even submit it to the county level. I don't anticipate any issues with getting data as of this point.
All right. Oh, okay, another question.
One more. James asks, do you know the response rate of the voluntary survey? From my experience in Appalachia, it's pretty rural and mind your own business type. Yes, the website that Dr. Holmes sent has a lot of that information. I don't have the rate right off the top of my head, but I know it does vary in different locations, but I know off the top of my head, 400,000 responses every year, and they get that, every year. And the most recent data they've put out is 2019, so they do have that recent data. But I don't know the rate off the top of my head. And that's across the country, 400,000 across the country, so not specifically in Appalachia. Okay. Any other questions? Okay, thanks for your time, everyone.
All right. Next up, we have Jennifer Premak. And if you want to go ahead and start sharing your screen.
Okay. Y'all hear me all right?
Yep, you're coming through loud and clear, and we see your slides, so that's good. All
Okay,
right,
great.
so Jennifer's going to talk to us this evening on Stone Valley Forest tree species classification using OBIA. Jennifer, whenever you're ready.
Hey, I'm Jennifer Pramick, and I'm getting my master's in GIS at Penn State. My advisor is Doug Miller, and my capstone is titled Stone Valley Forest Tree Species Inventory using Hyperspectral Imagery and LiDAR. Accurate individual tree species inventories are the core of sustainable forest management. Inventories provide knowledge of locations, distributions, and abundance of tree species. They also provide a resource for sustainable forest management, identifying and managing raw materials and resources such as timber, preventing soil erosion, sustaining biodiversity, and mitigating global climate change through carbon sequestration. Stone Valley Forest is a 7,000-acre heterogeneous mixed deciduous forest composed of mainly mixed hardwoods and some conifers. The area was abandoned by farmers in the 1930s due to difficulties farming the shaly soils, and by 1950s, the government deeded the forest to Penn State for use as an outdoor laboratory. In the late 80s and early 90s, large trees were cut down in order to promote shrub growth for the conservation of the woodcock, which is an important species for the area. The graphic here shows the extent of Stone Valley Forest in red, overlaying the hyperspectral imagery that will be used in this project. The main study areas in this project are Shale Hills and Leading Ridge. Shale Hills, marked by the yellow oval, will be where the project's workflow takes place, and the methodology will later be carried out through Leading Ridge. Shale Hills is also part of an organization called the Critical Zone Observatory, whose research promotes the understanding of how forested first-order catchment of shale bedrock evolves over multiple timescales in a temperate climate. The objective of this study is to create a tree forest inventory of dominant overstory trees, and this will be the first step towards a more sustainable forest management program, as well as creating a building block for future research within the forest. Traditionally, tree species inventories are done through a collection of field data on foot. However, this can be costly, time-consuming, and even unsafe depending on the areas being canvassed. Combining hyperspectral data with LiDAR data is more efficient for tree species inventories in that it can cover large areas and is repeatable in multiple areas of similar composition with similar imagery collections. Shale Hills will be the main area of interest in this study, and the methodology can be applied to the remaining portions of Stone Valley Forest, specifically Leading Ridge, for a more complete inventory. This chart shows which tree species will be classified. These species were chosen because they are dominant within the forest and are the trees which have the most field data available for use in the classification analysis. Though it is easy to distinguish the individual tree species in these photos, it is difficult to identify them when they are grouped together in a forest. The data used in this project will be hyperspectral imagery, 4-band orthoimagery, LiDAR, a digital elevation model, and intensity imagery. This high-resolution data was collected by Quantum Spatial and is in Pennsylvania South State Plane Coordinate System. The hyperspectral data was collected by a CASI 1500H sensor. This half-meter resolution 48-band imagery spans the wavelength spectrum of 380 to 1050 nanometers. This imagery was a special flight mission to collect data of the Stone Valley Forest specifically for Penn State. The graphic on the right shows how hyperspectral imagery compares to multispectral imagery in terms of band and wavelengths. Hyperspectral imagery is better than multispectral imagery in that it allows for minute differences in spectral signatures to be recognized, and this will help in distinguishing between tree classes. This map displays the Shale Hills field sampling collections. The trees sampled here have been identified and other detailed metrics have been inventoried as well. The inset map shows the full extent of Stone Valley Forest, and the green dot shows where Shale Hills falls within the forest. These are the trees that will be used in both ground truth data for classification and as reference data for the accuracy assessment. This chart shows a high-level overview of steps expected to complete this project. Essentially, hyperspectral imagery and LiDAR will be combined in order to train the support vector machine algorithm how to classify the specified tree species. What is object-based image analysis? At its core, object-based image analysis creates objects by segmentation and then uses these segmented objects for classification. Segmenting involves pixels being grouped. Pixels are grouped based upon a variety of things such as similarity, shape, texture, compactness, and external information such as height, which is provided by LiDAR. Pixels can be grouped based upon their relationship to other pixels and other objects as well. Recent studies have shown that creating objects on which to classify allows for greater classification accuracies than using pixels or LiDAR alone. The image on the right shows a preliminary multi-resolution segmentation that I have run to display how objects look once pixels have been aggregated into objects. Using pixels alone leads to the salt and pepper effect due to pixels being classified differently than neighboring pixels. Creating objects also allows for canopies to be aggregated, and each canopy's selected spectral signature takes into account inherent spectral variability among trees. The following slide will show how LiDAR will be used to create a canopy height model. First, vegetation below 2.5 meters will be removed, and the remaining first return LiDAR points will be used. First return LiDAR points below 2.5 meters will be removed, and the remaining first return points will be used to create a digital surface model using the triangular irregular network interpolation method. A canopy height model will then be created by subtracting the DEM from the DSM. The graphic on the bottom of the slide displays this process. The blue outlines where a DEM would fall, and the red outlines where the DSM would fall. Subtracting the two gives us a canopy height model. Due to the data being high resolution, there's potential for canopy height model gaps that could affect the classification analysis. If this issue arises, the PFSK algorithm will be used so that individual tree crowns can be accurately delineated. The following slides will outline the steps to clean up the hyperspectral data for analysis. As seen in the flowchart, non-forested areas will be masked, a minimum noise fraction reduction will be performed, and then shadows will be masked. Non-forested areas will need to be masked before the MNF reduction takes place. Non-forested areas are typically composed of farmlands, roads, and other structures such as buildings. eCognition will be used to generate a masked polygon shapefile by performing object-based image analysis. LiDAR will be used in conjunction with 4-band orthoimagery to find non-forested objects. High levels of data dimensionality lead to an issue defined as Hughes phenomenon. This describes how increasing the number of spectral bands leads to an increase of required training samples needed for classification analysis. The picture on the right side of the slide displays the high dimensionality of hyperspectral imagery in that it is continuous data rather than discrete data, which is found in multispectral imagery. Minimum noise fraction helps define which bands are uncorrelated. It is a transformation based upon two principal component analysis rotations, which uses principal components to decorrelate noisy data and then uses the noise removed principal components for a final transformation. This analysis will be carried out using NV software and is expected to deliver less than 25 decorrelated bands. These bands will be chosen based upon their eigenvalues. The exact threshold for this hasn't been determined yet, but typically the lowest eigenvalue falls somewhere between 3 and 8. Shadowing can affect classification in that shadows typically register as different objects within classification, so it is important to parse these out before the support vector machine is performed. Shadows are innately found within canopies due to the gaps within upper story trees and can also be found in other parts of the imagery as well, such as shadows caused by structures like buildings. The picture on the bottom of this slide shows gaps between trees, which is the cause for shadowing, and the image on the right shows how shadowing presents itself in an aerial imagery. In a recent study carried out by Trier et al., blue-green ratio was used to identify shadow areas due to blue wavelengths being higher than green wavelengths. eCognition will be used to parse out shadows by classifying shadow objects into their own class, thus making sure the shadows don't affect the tree's classification. The following slide will describe how crowns will be segmented. This is an iterative process, and the data used for this segmentation will be hyperspectral imagery in the canopy height model. Using the minimum noise fraction bands and the canopy height model, tree crowns can be segmented. This will be carried out by using the multi-resolution segmentation algorithm through eCognition. In order to determine the correct parameters such as scale parameter, shape, and compactness, reference crowns will be created. In order to create a set of reference crowns, a set of stratified random points will be generated to decide which crowns will be used. A preliminary over-segmented multi-resolution segmentation will be run, and the segments will be merged until they comprise of a complete crown. Manual edits may occur at this point, but the result will be a set of reference crowns. Then, a multi-resolution segmentation will be run on the complete data set until the outputs are significantly similar to the set of reference crowns. Right now, we are in the last steps of this project. The following slides will describe support vector machine learning. The inputs for the support vector machine algorithm will be reduced hyperspectral imagery, delineated crown objects, a canopy height model, and field data. Support vector machine separates classes by defining an optimal hyperplane between classes based on support vectors that are defined by training data. The graphic on the left of this slide shows a visual representation of how support vectors distinguish between classes. Sorry, that's my dog. Red and blue vectors are two separate classes. One second. Oh, sorry about that. The red and blue vectors are two separate classes. The hyperplane shows where maximum class separability falls. Tree crown objects will be created, and then each object will be classified using the support vector machine algorithm. This proposed classification not only does well at handling complex, highly dimensional, and noisy data, but it also does not need nearly as much training data as other comparable classification algorithms cited in recent literature, such as random forest, maximum likelihood, and linear discriminant analysis. Support vector machine is a well-known machine learning algorithm that has shown the capacity to classify tree species in temperate forests. The support vector machine classification will be carried out using a script created with eCognition. Field samples will be used in order to train the algorithm, and the exact number of training samples per tree species will be determined once the analysis is started. The previous slide showed how LiDAR and hyperspectral imagery will be combined for object-based image analysis and how a support vector machine algorithm will be trained and run. An accuracy assessment of the classification will be performed using a confusion matrix in order to determine the overall accuracy, producer's accuracy, user's accuracy, and kappa coefficient. This assessment compares the outputs of the analysis with field data. The amount of field data used to assess the accuracy will be determined once the analysis is started and the field data has been inventoried. The anticipated results are a point shapefile of classified tree locations, a confusion matrix for the accuracy assessment, a report paper, which I hope will get published in a journal, and an ArcGIS story map. The project timeline will start with getting the data, software, and project set up and ready to go. Then by May, the final projects should be complete. And that's the end of my presentation.
All right, that was an impressive presentation, Jennifer. As the questions start to come into the chat window, if you could read the question first before you respond, that'd be great.
Sounds good.
While people are writing their questions, maybe you could give a little preface to how you became interested in in this topic?
So previously I had been applying GIS to water resource management and decided that I kind of wanted to steer my career in a different direction. And forestry and natural resource management is a topic of great interest for me. And I guess Doug Miller told me about this awesome project that Penn State is doing. They collected some really high resolution data of the forest, Stone Valley Forest. And so I decided to kind of hop on and see what inventory we could get created.
Okay, thank you.
So let's see, I'll start out with Jennifer's question. Are you going to use field identified tree species as part of the training data set? Yeah, the tree samples that were collected, I had a map with a bunch of points on it. Each of those trees have already been identified. So that's going to be kind of the input into the support vector machine algorithm. So it'll essentially say, hey, this specific tree crown is, maybe an ash tree. And this one is, maybe a loblolly pine. And then through that kind of methodology, the algorithm will learn this is what this tree looks like, and this is what another tree looks like as far as spectral signature. And then I have another question. Have you considered convolutional neural network deep learning algorithm? That has kind of come up as far as in my previous remote sensing class, our professor did mention that deep learning has become kind of a new way to do this kind of stuff. I think really all the literature I read, for the most part, literature focuses on using support vector machine learning or random forest. And because there's the most literature out there, using that, and then also saying that it produces high accuracy rates somewhere and sometimes into the 90% range of accuracy. I kind of decided that with a high level of accuracy and a good bit of literature out there already, that I would just kind of continue down that path.
So any other questions for Jennifer? Well, if not, thank you, Jennifer. And we will move on to our next presenter, who is Robert Kent. So Robert, if you want to start sharing, we can see your screen. That's good. Robert is going to be presenting to us tonight on geostatistical analysis of gentrification and homicide in Washington, D.C. Robert, when you're ready.
Hey, everybody. Everybody hear me all right?
Yes, we can.
Okay, great. Well, my name is Robert Kent, and I'll be presenting my proposal for my capstone project. I'll be running a combination of geostatistical and temporal analysis methods to identify spatial relationships between gentrification and homicide in Washington, D.C. The goal of this research is to determine the relationship between residential displacement and homicide rates throughout the nation's capital over the last 2 decades. I chose this study area because DC is one of the most gentrified cities in the US and is the closest major urban center to where I currently live. Interestingly, DC has experienced increased homicide rates in recent years, while other crimes have actually dropped. Previous studies have shown that gentrification is a racial and socioeconomic process in which low-income urban areas are revitalized through heavy investment and infrastructure updates. This often results in wealthy individuals and high-end businesses moving in. Many low-income residents who cannot afford rising costs of living are often displaced from their homes and forced to find residence elsewhere. Multiple studies on gentrification in DC describe mass influx of wealthy white residents into the central wards of the city, with the northwestern wards remaining relatively upper middle class. The southeastern wards have remained mostly low income. Some studies have shown higher concentrations of low income residents in the southeastern wards. This may indicate that these wards are being directly affected by gentrification and displacement. Other studies show that displaced residents in DC have been disproportionately Black in comparison to other racial groups, with low-income Black female-headed households suffering the most. An increase in total Black population in the already low-income southeastern wards, when combined with the trend that low-income individuals generally suffer from decreased mobility, may indicate that a significant number of individuals displaced from the central wards of the city have moved into the southeastern wards. This is further supported by growing or pre-existing wealth in surrounding counties of Northern Virginia and Southern Maryland. In other words, residents pushed out of the central DC wards due to heightened costs of living, for example, would either need to move directly east into low-income wards or even further east into Prince George's County, Maryland, where some affordable housing still remains. And that's assuming that they're staying local in the area. Although property crime and violent crime rates overall have fluctuated over the past decade in DC, recent data published by the city indicates that homicide rates have shown a steady increase, especially in the low-income wards. So what's the problem here? The problem with gentrification is not that it brings new people into a community or even improves quality of life in specific areas. The problem is that gentrification side effects are often ignored at the expense of low-income residents. Longtime residents often become outsiders in their own communities. Many are even eventually forced out of their homes into potentially unpleasant situations or even more dangerous neighborhoods. This really begs the question, whose quality of life is being improved and who exactly is being displaced? Is there any correlation between growing displacement and rising homicide rates in DC? The three graphics on this slide were retrieved from a 2019 study on demographic shifts in relation to gentrification in DC by Lorenzo Morris of the Department of Political Science at Howard University. Figure 2 shows DC broken into the 8 election wards. This is essentially an aggregate of the much smaller census tracts throughout the city. Figure 3 shows the breakdown of race demographics per ward based on the 2010 census. White and Black residents make up the highest percentages throughout the city and will likely be the main focus for this study. Wards 2 and 3 have a large white majority, while 7 and 8 have a large Black majority. Wards 1 and 6 are a bit more diverse, with white residents making up the majority, while 4 and 5 are somewhat diverse, but with Black residents making up the majority. Figure 4 displays increases and decreases in median household income. Ward 3 has nearly plateaued as the highest income ward since 1999, with the highest white and lowest Black population in the city, while 1, 2, and 6 in the center of the city have all shown dramatic increases from 99 to 2011. These 3 wards make up the most gentrified part of the city. Wards 4 and 5 in the northern parts of the city have seen an overall income increase, but not nearly as much as wards 1, 2, and 6. While most of the wards have seen an increase in income, 7 and 8 definitely stand out as the only wards that have shown a decrease in median income. This is interesting because, as we can see in the race demographics above in figure 3, wards 7 and 8 have a very disproportionate Black majority. The 2020 census results, which are set to be released at some point next year, will provide an updated demographic picture of the city. Figure 5 displays areas of low income displacement versus concentration in DC. This is a very small piece of a 2016 national study conducted by the Institute on Metropolitan Opportunity. Researchers used census data across the US and the 2016 American Community Survey to map these results. Census tracts have been characterized by the net change in number of low income persons per tract. This study defined low-income individuals as those who fell below 200% of the US federal poverty line. Blue tracts indicate areas with heavy decrease in low-income residents, while red tracts indicate areas with heavy increase in low-income residents. The darker the shade of blue or red, the greater the intensity of decrease or increase. Other useful demographic shifts collected in this study include net change in race and education levels per tract. This information provides an additional element to complement the raw census data observed on the previous slide, and has helped narrow down the areas of interest for this study. Wards 1, 2, 5, and 6 in the central part of the city are most characterized by gentrification, where low-income displacement is high. Wards 7 and 8 in the east and southeast are most characterized by low-income concentration. Ward 4 in the north is relatively blended in terms of displacement concentration and no significant change, while 3 in the west has remained the wealthiest ward with no significant change. It is also worth noting that most of the low-income concentration zones in the greater DC metro area and manifested in the eastern parts of DC and further east into Prince George's County, Maryland. Figure 6 shows the broader picture of median household income throughout the DC metro area. The dark blue areas indicate highest income, while white areas indicate the lowest. Displacement is difficult to track because information pertaining to where individuals move from is not always readily available. However, the supported notion that lower income individuals experience decreased mobility indicates that many displaced persons will likely end up somewhere that is nearby and affordable. Wards 7 and 8, with their historically low and decreasing income rates, would provide sort of a catching zone for residents pushed east out of the gentrifying central wards. High incomes and associated high cost of living in adjacent counties to the northwest and southwest would prevent most immediate movement of low-income residents to the west. It should also be noted that at this point, I'm not declaring any causation or correlation, simply observing spatial trends across DC and adjacent counties that should help shape the analysis moving forward. There's no concrete evidence at this point showing that individuals displaced from gentrified areas of the city are the same individuals moving east into Wards 7 and 8. As a part of this analysis in the study, I'll attempt to address this and at least draw some sort of correlation based on racial and income factors. So over the past decade in Washington, DC, violent crime rates have actually been dropping steadily throughout most of the city. And it's been stable in others, but homicide has particularly shown an increase, which stands out. This crime data has been pulled from the DC Metropolitan Police Department's public records and is being displayed on DC crime cards. These are customizable maps offered as a map tool on their site. On figure 7, the filter has been set to display violent crime over the past 8 years on a ward map. On figure 8, all violent crimes have been filtered out except homicide, which is also displayed on a ward map. So without any additional information, it's pretty clear even at a glance that wards 7 and 8 tend to experience the most violent crime in the city. Referring back to previous slides, These wards have the highest number of low income and Black residents in the entire city. After adjusting the filter to observe only homicide rates in wards 7 and 8, not only has homicide occurred most in these two wards, but it has seen a steady increase. Figure 9 shows the increase in homicide rates in Ward 7, while Figure 10 shows a similar trend in these variables in Ward 8. Figure 11 has been included just for quick referencing. None of the other DC wards have shown an increase in homicide, and Wards 2 and 3 don't even have enough homicide incidents to show any type of trend. So as far as my project objectives goes, I will attempt to determine spatial relationships between gentrification and displacement in DC, identify any spatial links between race, income, displacement, and homicide rates in DC, and build upon other research that highlights the effects of gentrification. So as far as my methods go, this is going to be kind of an overview. So bivariate Moran's eye and bivariate local indicator of spatial association, known as LISA, will be the focus of the analysis. Bivariate Moran's eye involves measuring the spatial correlation between one variable and a lagged version of a second variable. Instead of looking at one-to-one relationship between variables, spatial contiguity will be the main focus. I chose this method because of the less than concrete nature of gentrification and related displacement. While looking at regression between variables can be very useful, especially in non-spatial contexts, the tendency of similar spatial phenomena to cluster should not be discounted. In other words, we must account for autocorrelation. Bivariate LISA will be used to identify local clustering between variables. I'll measure spatial correlation and significance between net change of low-income residents and net change of different racial groups in gentrified areas using the geostatistics software GeoData. I will do this within a gentrified tract shapefile and throughout the entire study area as well. For racial groups showing significant spatial correlation between net change of low-income residents and net change of different racial groups within gentrified areas, I'll repeat the process within a concentration tract shapefile. I will then repeat the process between each of the previously mentioned race and income variables and the net change of homicide in the concentration tracts shapefile. After determining any spatial correlation, I'll use the DC wards feature class with homicide totals per year to perform a temporal analysis using a combination of thematic maps and line graphs. So as far as data retrieval goes, I've located all the data I need at this point, starting with the 2010 DC Census polygon shapefile. This will be used as sort of a starting point for the data preparation. We've got the 2012 ward shapefile, which will be used to aggregate the census data for the temporal analysis. The net change in demographics and income data for each census tract will need to be manually inputted from the 2000 to 2016 gentrification data map display into the census tract shapefile. The DC crime shapefiles for each year starting in 2007 and moving through 2020 have been made available on the Open Data DC website. Although the years of data available do not line up perfectly, gentrification is a complex issue in which the effects upon the community are not always immediately realized. Using this data will show crime trends as they fluctuate during the years of tangible gentrification and onward into future as a potential result of displacement. The data preparation workflow I've drafted is broken into three main processes. The first involves initial data setup and organization, then manual data input from the 2016 Institute on Metropolitan Opportunity Map. I'll start by downloading all the data mentioned in the previous slide. I'll then load the data into a working map in ArcGIS Pro to be used in this process and later processes. Next, I will export the census tract shapefile as a new feature class. Using data from the Institute on Metropolitan Opportunity, I'll need to create new fields in the census tract shapefile for each of the net change subgroups. These subgroups will include middle to high income, low income and low income percentage, below poverty, extreme poverty, Asian, Black, Hispanic, and white. I will then input the net change in subgroup data into each new field for each of the 179 census tracts. This will give me a census tract feature class that holds the additional net change in subgroups data to be used in later steps. The second process involves the creation of the homicide per tract shapefile to be used in the analysis in GeoDoc. Using data that was previously loaded into ArcGIS Pro, I'll first select homicide by attributes and export as new feature classes from the 14 different crime shapefiles for each year from 2007 to 2020. I will then join the census tract feature class table, which was prepared during the first process, to the new homicide feature classes for each year by tract number. From here, I will create individual homicide raster layers for each and produce zonal statistics tables for each year of homicide data to achieve homicide count per tract. Next, I will join each of the homicide count tables to the census feature class, create and populate a new field for net change in homicide from 2007 to 2020, then export the census tracts feature class as a homicide per tract shapefile. Referencing the Institute on Metropolitan Opportunity gentrification map, I will manually select gentrified tracts and export as a new gentrified tract shapefile. Using the same referencing method, I will manually select low income concentration tracts and export as a new concentration tract shapefile. The homicide per tract, gentrified tracts, and concentration tract shapefiles will be used for geostatistical analysis in GeoDoc using methods covered previously. The third process involves aggregating homicide rates from tract to ward and creating a new feature class to be used for temporal analysis. First, I will spatially join the tract and ward shapefiles and export as a new feature class. Next, I will select ward number by attributes for each of the 8 wards, and within each selection, perform summary statistics using each of the 14 years as input fields to create tables with homicide totals per ward. Finally, I will join the newly created summary tables to the original ward shapefile and export to a new homicide per ward feature class. This will be the layer used in the temporal analysis in ArcGIS Pro. So as far as my anticipated results, I plan to solidify the spatial relationships between gentrification and displacement in DC, determine spatial links between race, income, displacement, and homicide in DC, and validate to some degree other research that highlights negative effects of gentrification. Without becoming too biased, I hypothesize that there will likely be correlation between net increase in white population with net decrease in low income residents in gentrified areas, as well as correlation between net increase in Black population with net increase in low income residents in the low income concentration areas. If I have narrowed down the areas of interest properly using net change in race and income, I hypothesize that the low income concentration areas as a result of gentrification in other areas will correlate with areas that have seen an increase in homicide rates. As far as challenges and limitations, although I'm optimistic towards moving forward with the project, I've identified a few challenges and limitations that should be accounted for appropriately. The first involves data availability. Although what I have gathered should be sufficient, it is not ideal in a perfect scenario in which I would have gentrification data and crime data that both span all the way from 2000 to 2020. Secondly, some of the data preparation will be extremely time consuming. Manually inputting the 2016 Institute of Metropolitan Opportunity data into each of the 179 tracts of the census shapefile will be quite the chore. Other processes may be improved in the future through either a model builder automation tool in ArcGIS Pro or a Python script using loop commands. The third challenge lies in the interpretation of the statistical analyses themselves. Although bivariate Ron's eye and bivariate Lisa are incredibly useful tools that can help identify spatial relationships, they do not provide the one-to-one correlation that is achieved through regression methods. This, however, is an acceptable compromise simply because of the nature of the spatial data I'm working with. Normalizing the data for regression sometimes comes with the risk of altering the integrity of the data while attempting to mitigate autocorrelation in the dataset. Therefore, the limitations associated with the chosen geostatistical methods are more of a reminder of caution when interpreting the results, that even though clustering and local averaging may point to certain trends, they cannot achieve direct one-to-one correlation. As far as my timeline goes, I'll begin preparing the data as soon as this proposal is approved, and will implement any appropriate feedback from students and advisors. I plan to start Geography 596B in early January, and we'll be able to have the project and associated report fully completed by the end of that course in mid-March of 2021, which is a pretty aggressive timeline that I'm aware of. But this should fall in line with my graduation plans for May of 2021. As far as venues go, ideally, it would be good to present this project at a Washington, D.C. town hall meeting or some sort of urban development conference, but due to COVID-19 restraints, I may need to present the project within Penn State's online environment along with other students, but that's still kind of up in the air at this point. So depending on the results of this analysis, the findings may be used to support or protest gentrification in Washington, D.C. and perhaps other major urban centers. Studies in urban development and gentrification are important because they often highlight the struggles of the often neglected lower income classes. Although urban development is unavoidable and usually supported by many parties, there may be room for some effective compromise. I hope to contribute to this rather large body of research and provide key decision makers in urban development with the information required to invoke creative legislative solutions to the problems associated with gentrification. So this concludes my presentation. Thank you for your time. I'd also like to thank my advisor, Greg Thomas, for all his help in getting me to this point throughout the semester. I'll now be taking any questions or feedback.
Okay, thanks, Robert. That was a great job. Very important topic. Just one reminder, as the questions start to come in through the chat window, if you could repeat the question before you answer it, that'd be great.
Okay. Okay, so from Raul, I've got, says you touched on this in your challenges, but what is the latest data you have that can still successfully do the project? So I think what I have is going to work because I'm looking at, as far as the gentrification data goes, looking from 2000 to 2016. And then as far as the crime data goes, I'm looking at 2007 to 2020. So there is a pretty significant amount of overlap as far as the time goes, which I think will actually work out because we're kind of looking at homicide increases as a potential result to the gentrification occurring in other areas of the city. So I think what I have now will actually do the job pretty effectively. And of course, as the 2020 census comes around, that'll give us additional information to go off of. Okay, and then I've got Alexandra. Have you considered historical events as part of the temporal analysis in terms of major events, such as elections, major business entering the area, such as Amazon? That's a good one. And then displacement gentrification increased drastically when that stadium was built. Yep. Yeah, that's definitely a lot of good stuff to look at, which some of it I've observed in the background research as potential reasons to why these things are happening. So I think that could be maybe an addition to this this project is kind of a follow-on, because the thing with the thing with gentrification is it's really a complex issue that the I guess all the variables are not always as concrete as you think they might be. So I think the more study done in this area, the better. And I think that looking at those historical events and seeing how things change, of course, with data availability, depending on how far back you want to go, could be really effective. So yeah, I think that would be really awesome for a follow-up project. Any other questions or feedback?
Well, very good. I'd like to take this time to thank all of our presenters for a wonderful job on their 596A projects. A lot of interesting things, and can't wait to hear the completion in 596B. Also want to thank all the folks that showed up, asked questions, and listened in the audience. I know this takes time away from your evening, but really appreciate that, and giving support to the presenters. Before we leave, I'd like to remind all of our presenters that there is the peer review evaluation form. Beth put the link to that in the chat window, so please make sure to fill that out, and that will help all the other presenters get additional feedback from you. We have another presentation slot tomorrow at 11 a.m. to 1:30 p.m. Eastern Standard Time. We have 5 presenters lined up on a wide range of topics, so it should be an interesting time. So if you have plans, make sure to attend. Other than that, I wish everyone a good day or good evening wherever you are, and we'll see you back here again.